Mental health encompasses emotional, psychological, and social well being, influencing cognition, perception, and behavior. Mental health plays a crucial role in an individual's daily life by managing stress, engaging with others, and contributing to life overall. According to the World Health Organization (WHO), it is a state of well-being in which the individual realizes their abilities, can cope with the normal stresses of life, can work productively and fruitfully, and can contribute to their community. It likewise determines how an individual handles stress, interpersonal relationships, and decision making. Mental health includes subjective well being, perceived self efficacy, autonomy, competence, intergenerational dependence, and self actualization of one's intellectual and emotional potential, among others. Mental health also includes emotional, psychological, and social well being, and it affects how people manage stress and make everyday decisions. From the perspectives of positive psychology or holism, mental health is thus not merely the absence of mental illness, rather, it is a broader state of well being that includes an individual's ability to enjoy life and to create a balance between life, activities, and efforts to achieve psychological resilience. Cultural differences, personal philosophy, subjective assessments, and competing professional theories all affect how one defines mental health. Mental disorders. Mental health, as defined by the Public Health Agency of Canada, is an individual's capacity to feel, think, and act in ways to achieve a better quality of life while respecting personal, social, and cultural boundaries. Impairment of any of these is a risk factor for mental disorders or mental illnesses, which is a component of mental health. In 2019, about 970 million people worldwide suffered from a mental disorder, with anxiety and depression being the most common. The number of people suffering from mental disorders has risen significantly over the years. Mental disorders are defined as health conditions that affect and alter cognitive functioning, emotional responses, and behavior associated with distress and or impaired functioning. The ICD-11 is the global standard used to diagnose, treat, research, and report various mental disorders. In the United States, the DSM-5 is used as the classification system of mental disorders. Mental health is associated with a number of lifestyle factors such as diet, exercise, stress, drug abuse, social connections, and interactions. Psychiatrists, psychologists, licensed professional clinical counselors, social workers, nurse practitioners, and family physicians can help manage mental illness with treatments such as therapy, counseling, medication, and trauma informed care. Mental health in the digital age. Digital technology has an increasing impact on mental health. Research suggests that constant online connection can increase stress, while digital tools may also expand access to mental health support for people who cannot easily receive in-person care. Research also shows that digital media use can affect adolescents' emotional well-being, social development, and mental health outcomes. Cyberbullying and online harassment can worsen mental health symptoms in children and adolescents. Studies show links between online bullying, depression, and anxiety. History. Early history. In the mid-19th century, William Sweetser was the first to coin the term mental hygiene, which can be seen as the precursor to contemporary approaches to work on promoting positive mental health. Isaac Ray, the fourth president of the American Psychiatric Association and one of its founders, further defined mental hygiene as the art of preserving the mind against all incidents and influences calculated to deteriorate its qualities, impair its energies over the range of its movements. In American history, mentally ill patients were thought to be religiously punished. This response persisted through the 1700s, along with the inhumane confinement and stigmatization of such individuals. Dorothea Dix, 1802 to 1887, was an important figure in the development of the mental hygiene movement. Dix was a school teacher who endeavored to help people with mental disorders and to expose the substandard conditions into which they were put. This became known as the mental hygiene movement. Before this movement, it was not uncommon that people affected by mental illness would be considerably neglected, often left alone in deplorable conditions without sufficient clothing. From 1840 to 1880, she won the support of the federal government to set up over 30 state psychiatric hospitals. However, they were understaffed, under-resourced, and were accused of violating human rights. Emil Kraepelin in 1896 developed the taxonomy of mental disorders, which has dominated the field for nearly 80 years. Later, the proposed disease model of abnormality was subjected to analysis and considered a normality to be relative to the physical, geographical, and cultural aspects of the defining group. At the beginning of the 20th century, Clifford Beers founded Mental Health America, National Committee for Mental Hygiene, after publication of his accounts as a patient in several lunatic asylums, a mind that found itself in 1908 and opened the first outpatient mental health clinic in the United States. The mental hygiene movement, similar to the social hygiene movement, had at times been associated with advocating eugenics and the sterilization of those considered too mentally deficient to be assisted into productive work and contented family life. In the post-World War II years, references to mental hygiene were gradually replaced by the term mental health due to its positive aspect that evolved from the treatment of illness to preventive and promotive areas of healthcare.